Good evening from New York. This is Tuesday, January 18th, 658 days until the 2012 presidential election. The Republican Don Quixotes planning to repeal health care reform finally got their moment in the imaginary sun this afternoon. And in our fifth story, basking in the pretend warmth, they revealed their two-pronged attack. One, resuscitate an old trick, cherry-pick intel about a threat to America, and two, warn that the reform was written by the greatest threat to our or any other nation. Smart people! But so it begins. 7 hours of debate over 2 days with the purely symbolic repeal vote due tomorrow. And in the category of unintentionally funny for the ages and telling, the prize goes to a Republican speaking off the House floor at the GOP's repeal news conference. Congressman Louis Gohmert damning those smart people who wrote the Affordable Care Act.
You need to understand how insidious this bill is. This was written by smart people hoping that there would only be a few things removed.
And thus, Congressman Gohmert may have just stated the number one reason why the Affordable Care Act will never be repealed, ever. Inside the Capitol, Congressman Chris Van Hollen offered the obvious, but possibly still the best critique of the GOP's repeal and replace nonsense. Insurance premiums skyrocketed under the GOP's prior control of both houses of Congress, while that party did nothing. And as for the current GOP replacement,
why not put your plan on the table first so everybody can see it before you begin taking away the important patient protections in this bill, taking effect just since last March?
But Republicans today offered their favorite attacks on the Affordable Care Act, even as those claims were picked apart by independent analysis. The GOP claimed that the Affordable Care Act will create the loss of 650,000 jobs, citing the Congressional Budget Office for this analysis. Not true, unfortunately, according to the Associated Press. The CBO offered no such number, but it did offer an analysis at odds with what the GOP claims it said. Another part of the GOP report, citing the Congressional Research Service, chops a sentence short. According to a simple review by McClatchy newspapers, the omitted sentence, quote, would not be a burden on small business owners. And broadly speaking, many factors limit the impact the law can have on businesses because the law's implementation is staggered and small employers get tax credits, as noted today by Congressman Anthony Weiner.
Small businesses get a 30 to 50% tax incentive to provide health care for their workers. Small businesses do. And you know what requirements they have that go along with that? None. No gaudy regulation, no government takeover.
Meantime, the executive branch, Democrats in Congress, and outside groups are prepared to fight this battle on several fronts. The Department of Health and Human Services today releasing this. If the Affordable Care Act were repealed, between 50 million and 129 million Americans under the age of 65 would be affected because of pre-existing conditions. The percentage of the U.S. population thus gaining protections under this Affordable Care Act is up to 3 times the total number of the elderly in America. A new cable TV ad from the advocacy group Americans United for Change.
The Affordable Care Act gave your family the same health protections members of Congress get, but Republicans want to take that protection away from your family.
And while House Republicans hold anti-health care reform hearings, Senate Democrats will counter with their own hearings. Help Committee Chairman Tom Harkin starts his series of hearings January 27th. Thanks for the birthday present. Then there is the former Senate Majority Leader, Republican Bill Frist. If Mr. Gohmert did not provide a big enough laugh, he said that the Affordable Care Act should not be repealed, even though it needs work. Here's the laugh, quoting, "It is the law of the land and it is the platform, the fundamental platform upon which all future efforts to make that system better for that patient, for that family, will be based." That's not funny, that's wise. Here's the funny. The bill has many strong elements, and those elements, whatever happens, need to be preserved, need to be cuddled, need to be snuggled, need to be promoted, and need to be implemented. Let's bring in Washington Post staff writer, Newsweek columnist, and MSNBC contributor Ezra Klein. Ezra, good evening.
Good evening, Keith.
The cuddling and snuggling report later.
But it's the new civility.
I guess this is sickening, actually, the new civility. This job-killing catchphrase, you've explained previously the difference between employers who cut jobs versus employees who voluntarily leave their jobs or the workforce because of the benefits of the health care laws. But this bears repeating today particularly, so please go ahead and repeat.
Sure. Here's what CBO said. The bill, because it gives people essentially more money in their pocket because it helps them purchase health care insurance, and because it makes it impossible essentially to discriminate based on pre-existing conditions, will give certain people who would like to retire, say a 62-year-old who has diabetes, the ability to retire, because when they leave their employer, they'll be able to buy health care insurance on the market on their own. Now, that does mean you reduce the labor supply somewhat. You have somewhat fewer people who are working because they don't need to work anymore, or they don't want to work anymore. But this is reducing labor supply by making people effectively richer and by making it easier for them to get health care insurance. I do not, because we're all in the new civility era, I don't think the Republicans don't want that to happen. They're just twisting what CBO said in order to make it look worse. But that's what they said, that this bill will make people richer and make it easier for them to get health care. All
right, the stuff that Dr. Frist said before he got sort of off on that kinder, really gentler GOP, he would have voted for this act, even though it's not the bill he would have drafted. Now he's criticizing the repeal effort by the Republicans. He also owns stock in a for-profit hospital chain. But is there some suggestion in here that not being involved in a political machine like the Republican Party in the Senate and the House, he has sort of hit that same common sense duh moment that most Americans get to here, that you let the thing evolve, that it is in fact a good start, you make fixes as needed, you don't go back to square one when the first couple of squares have been successfully hurdled?
And this goes to the basic point about the Repeal Act that makes it so sort of problematic. You know, Republicans really do have the votes to change the bill. They had the votes when it was being crafted to get enormous compromises from the Democrats. Senate Democrats, Max Baucus, would have pretty much done anything for 4 Republican votes. I mean, they could have had essentially whatever they wanted. But they never said, here's what we want. In return for this, we will give you our votes on the bill. And here, too, they're trying to go for a whole repeal, which they know they can't get, as opposed to sitting down with the Democrats who've already put forward a willingness to go back to things like the 1099 reporting requirement for small businesses, which Republicans don't like, and change them. And so there's been a real effort to play this based on politics as opposed to make it a policy that Republicans and conservatives can be happier with. This despite the fact that it looks a lot like what Mitt Romney did in Massachusetts and what Republicans coalesced around in 1993 under Bob Dole. It's a policy that at another time would have been very congenial to the Republican Party, but because it's got Barack Obama's name next to it, has been greeted with rather less enthusiasm.
And within the policy issue, there are still 2 different approaches. There was much talk from Republicans today about health care reform exploding the deficit, even though the CBO disputes that as well. But while the Republicans are talking like money and this is going to do this and it's going to, they're focusing on all those aspects while the Democrats are working on the human factor, pre-existing conditions, kids, on parents' policies, stuff like that. Is that the basic dynamic of the rest of this thing, however long it lasts?
It often goes both ways. You'll hear Republicans make the deficit argument, which it does not hold up to any sort of serious scrutiny. And you also hear them say, but it cuts Medicare for your grandmother. Of course, cutting Medicare is part of why the bill saves money, and that little tension gets elided a little bit. But, you know, you do see different types of rhetoric in this. Some of it is trying to focus on personal stories. Democrats are trying to move more in that direction. Other bits focus on cost, because in general what people are truly worried about is cost. But the reality is the bill helps individual people, and it does cut cost. It's a good bill, and it should be built on.
Ezra Klein of The Washington Post. Great, thanks.
Thank you.